Good afternoon, everyone. My name's Adrian Dix. I'm BC's Minister of Health. In Victoria today is Dr. Bonnie Henry, BC's Provincial Health Officer. This is an update on the COVID-19 situation in Northern Health. I'm here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. Dr. Henry is in Victoria on the territory of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. Over the past few weeks, as all of you know, our healthcare teams and really everyone in Northern Health, our mayors and communities, our leaders in Northern Health, our Northern Health leaders, our Northern Health healthcare workers, our MLAs of all parties, from Shirley Bond, the leader of the opposition, to Nathan Cullen, have spoken up and shown leadership in the need for everyone to get vaccinated. And people in the North have done, I should say, exceptional things in this period. And I want to start by saying today, thank you. Thank you to the healthcare workers who go above and beyond every day. Thank you to the business owners who are adapting the way they operate. Thank you to every single person who has taken the steps to be vaccinated. We are grateful to each and every one of you for stepping up in this difficult time. I want to say that the situation in the North, as we reported in detail on Tuesday and previous to that, is an enormous challenge, not just for the North, but for all of British Columbia. Just to put it in context, 58 people have been transferred by plane out of the North to hospitals, either in Island Health in their majority or in Metro Vancouver. 58. 25, for example, from the two Peace River local health areas. All of them very ill. Some of them without COVID-19, but without room for them at their hospital in their region so that they can get high quality care. But the majority with COVID-19 in critical condition. It's a significant situation when you think about it, when you think about communities and the impact of that, of going from your family, say in Dawson Creek, 900 kilometers to the Nanaimo Regional General Hospital or Victoria or Royal Jubilee Hospital. It is a powerful and profound thing, something we would not wish on anybody. They are sick, desperately ill, and it's been 58 so far. On Tuesday, I told you we have 40 base critical care beds in the entire northern British Columbia. That's not for COVID-19, that's for everything. And we've added 23 surge beds to support that. And they're staffed by some of the best teams of healthcare workers in the world. So when you're talking about moving 58 people out of health authorities that have 40 base critical care beds, all of them critically ill, that's a significant situation. And it demonstrates what we've said consistently, which is that we will do what it takes every day to support the North, just as the North did when we needed to support situations in other communities, in Fraser Health, or in Whistler, or in Surrey, or indeed earlier in the North, in Prince Rupert, where significant and special actions were taken to support people in communities. We do this for one another because we believe that that is what we do as British Columbians and as Canadians. We support one another in a public healthcare system that responds. But that being said, it doesn't mean that transfer is acceptable. It doesn't mean that the 260 cystoscopies that we've had to cancel in Northern Health, other patients who need care, who are crowded out of their hospital that they support, that supports them in a public healthcare system because of COVID-19. This is a significant situation, and this in the North. 58 people, 45 of them with COVID-19, all but one of them not fully vaccinated who have been transferred out, demonstrates why we need to continue to take action together, why we need a circuit breaker to address, continue to support all of the other steps we're taking in Northern Health. We are all in. We have thrown everything in but the kitchen sink, and the kitchen sink went in a week ago. We are doing everything we can to support the North, and we will continue to do that. But we also need to ask people in the North to do more. As you'll know, in early August, on August the 6th, we took actions, regional actions, in the Central Okanagan local health area, actions that were in fact taken back on September 13th after progress had been made. We took actions specifically across Interior Health on August 20th because of outbreaks and because of transmission in that region. We took further action in the Northern Health Authority on September 2nd. It was announced here, and it was put in place on September 7th. And then in the Eastern Fraser Valley, that part of the Fraser Health Authority that comprises of Chilliwack and Abbotsford and Mission and Hope and other communities, we took action on September 28th. In a period of vaccination, these specific regional actions and measures are what Dr. Henry and our regional health teams and our medical health, chief medical health officers, such as Dr. Kim, who's on the line for us from the north today, have been taking to address situations. And that is what we're announcing today, and Dr. Henry will be announcing today. We are committed to supporting the north every day. We need to take steps together to reduce transmission in the north. And I'm honored, as always, to introduce Dr. Bonnie Henry to detail those steps.
Thank you, and thank you very much, Minister, for expressing the concerns that we've been dealing with across the north. As we know, there are pockets across the province where immunization rates are not high enough to prevent this virus from being transmitted and transmitted rapidly amongst people who don't have that protection. Earlier this week, we expressed our growing concern about the rate of transmission that we're seeing in many communities across the north. And I've been working with Dr. Jung and Kathy Ulrich and our teams to determine what it is that we can do that will put a stop on the transmission that we're seeing now, that will protect people from getting sick from this virus, ending up in hospital. And we know that it's affecting across the province. We are in a very different situation than we were in even a few months ago. The new variant, the Delta variant that we are seeing across the province, almost 100%, is way more transmissible. It spreads faster, and it spreads with a small amount of exposures in a different way than what we have seen with previous strains of the virus that have been in our community in the last year and a half. And we are seeing it cause more severe illness in younger people. So if you were somebody who is young and healthy and thinks, I'm just going to get through this, no problem, that's not the case now. We're seeing this across the province, but particularly in communities in the north where unvaccinated people in their teens, but primarily in their 20s, in their 30s, in their 40s, are ending up in critical care, ending up in hospital. And today, tragically, we had a young person in their 20s die from COVID in the north. We need to take additional measures to stop this transmission, to stop this severe illness in young people, in middle-aged people, in people whose immune systems aren't working as well across the north. As Minister Dix mentioned, we are seeing hospitals and ICU filling up with young, otherwise healthy individuals struggling to breathe with COVID-19. And many people, even if they have mild illness, are now having long-term effects. This is affecting not only the people who have COVID and their ability to get care, but as we're seeing now, it's spilling over into communities, meaning that young people can't get care for the issues they have, people who need cancer treatment, people who have heart attacks. It's now a challenge for everybody in our community, so we need to take additional actions. As you know, regional orders came into effect in September, and today additional regional orders by Dr. Kim, the Chief Medical Health Officer, under the Provincial Health Officer order will come into effect, and we will be stepping up the restrictions that we already have in place across much of the north. We are doing this to stop transmission where it is greatest, and that is those indoor gatherings where we're coming together, where we're not necessarily wearing masks, where we're mixing with unvaccinated people, and this is where we're seeing spread. These changes will apply to the entire Northern Health region with the exception of the local health areas west of Kitawanga, including Terrace, Kitimat, Haida Gwaii, Prince Rupert, Stikine, Telegraph, Snow Country, and the Niska areas. So those are areas where we have seen this virus not being able to spread because of those high rates of vaccination and people taking the precautions that we've asked. But effective midnight tonight through Friday, November 19th, we're trying to make this as time limited to address 2 incubation periods, to stop the hospitalizations, to stop the severe illness. The following orders will become in place. Personal gatherings, both indoor and outdoor, will be restricted to fully vaccinated people only. If you are unvaccinated or have unvaccinated people in your households, then you need to stay with your household only. In addition, indoor gatherings will remain restricted to 5 people and outdoor gatherings to 25 people if they are all fully vaccinated. All indoor and outdoor organized events, so these are the weddings or parties that you are having with an organized event, require a safety plan, a COVID safety plan like what we had in place. It requires everybody to wear masks and to ensure that everybody is fully vaccinated, and that means using the BC vaccine card to ensure that any attendees are fully vaccinated. Indoor events will be limited to 50 people, even fully vaccinated, and outdoor events up to 100 people are permitted. We've had a lot of challenges, and I've worked, and I want to give my thanks to the many faith leaders across the north and across the province. We have put in guidance to help ensure safe practices, but unfortunately with the amount of transmission we're seeing in the north, it is no longer safe for us to have mixing of people who are unvaccinated in these worship settings. And for the next period of time, worship services will be limited to virtual services only. We can have single-person services where you can go and have quiet reflection in a religious service. But like what we had in the spring, we're now going to be restricting in those areas where transmission is greatest, those high-risk environments, including worship services. We also know that we have issues with people being able to use the BC vaccine card. It is an effective measure, and we've seen that in many communities, to ensure that we are mitigating any risk in some of those indoor environments like restaurants, bars, and nightclubs. Right now, we are seeing that those are not enough in areas in the north, and restaurants will continue to allow in-person dining or inside dining with the use of the BC vaccine card. So if you have full service, meal service, but we are restricting the serving of alcohol to 10 p.m. For bars and nightclubs, unless a full meal service is provided, these premises with a license to serve liquor must now close at 10 p.m. I'm sorry. Will now be closed for this period of time. In addition, sports events with spectators, so indoor and outdoor, will be limited, as we know, to 50% capacity. They must have a COVID safety plan, and attendees must wear masks when in the indoor setting, and they must use their BC vaccine card to show proof of being fully vaccinated to attend as a spectator. In addition to these changes, we are strongly encouraging people to remain within your community unless it is essential to travel for work or for medical reasons. We know this virus right now is spreading rapidly, and we take the risk from where we come, we take it with us when we're traveling, we bring it into that community, and we take that risk home with us. We know this virus transmits most easily to those people we are closest with. The people that we are with in indoor settings where ventilation may not be great, where we're not wearing masks, when we're eating, when we're talking loudly, when we're singing with each other. Those are the things that we need to scale back now so that we can stop this transmission. We can prevent those people who are not yet protected through vaccination from getting seriously ill. We can take that pressure off our healthcare system. These measures are to stop transmission and to save lives. We're talking about our children who are too young yet to be protected, and people whose immune systems are compromised, where they can't mount a strong immune system, even with the 3 doses that we are now recommending. These are not orders to be gamed or to be got around to try and float the rules because you think they don't apply to you. These are your community members. These are your family members. These are our family members who are being affected. And to support these efforts, we are also stepping up our coordinated enforcement of the BC vaccine cards where they are required to help support those businesses in staying open, being able to support people who are protected to gather in those safe settings. We do not take these actions lightly, and I recognize the impact of what we are requiring of everybody living or working in the Northern Health Region and across the province. We are intending this circuit breaker to save lives, to lower the rates of transmission, to allow our hospitalizations to stabilize, and enable us all to come back together safely to celebrate during the upcoming holiday season, I hope. Along with this, I just want to make people aware, I've talked about this in the last couple of media briefings that we've had, that we are, that a PHO order for healthcare workers outside of long-term care, so in acute care and community care, that order is posted now on the PHO website, and it is broad. It covers healthcare workers that are staff for our health authorities, the PHSA, the BCEHS, Providence Healthcare, anybody who works for the Ministry of Health and Mental Health and Addictions, as well as employees, contractors, and health professionals in the community. So I want people to be aware that it is very broad. It is because we recognize the absolute importance of protecting healthcare workers by making sure we are immunized, to protect ourselves and our families, to protect our colleagues so that we can continue in our very stretched system to provide care for others as well, and to protect those most vulnerable that we care for. The order will require staff to report their vaccination status to their employer, and students are included as well. And we will, staff must have at least one dose of vaccine by October 26. Follow prescribed preventive measures that we've talked about, and get the second dose within 28 to 35 days. If people do not have their first dose by October 26th, then there will be increasing provisions for them to be off work, and progressive enforcement up to and including termination. So the order contains rules for outside healthcare, personal care support, personal service, and other outside providers, as we call them, with respect to access and vaccination status, similar to the requirements already in place for long-term care and assisted living. I also want to say that this order will apply to regulated health professionals in private practice, and I'm working in a process with the colleges to make sure that we have that in place in a way that supports physicians, nurses, dentists, all of the health professionals across our province to be protected and to protect those we care for. I don't have to say this, but the COVID-19 virus is putting us all to the test. And we have seen in some parts of the province where we've been able to manage and to cope and to suppress the transmission. And that is the good news that we're seeing. But there are regions of the province where we have not yet made enough progress to get there. And that is challenging our healthcare system, the people who care for us. It's causing hardship and it's causing loss. But we have a way through this storm. And through the vaccines that we have and using all of our layers of protection, following all of the public health orders that are there because we know they work to protect us, to keep our families, our communities, and ourselves safe. Follow the guidance we have in place. And let's all continue to do our part together here in BC while being kind to each other and remembering the importance of staying calm and staying safe. Thank you.
To take your questions, I think that's being handled in Victoria, and it'll be on the questions. Dr. Henry will respond first, unless it's directed at me, and we'll go from there. So over to you.
Thank you. very much, Minister. A reminder, one to enter the queue. You will be limited to one question and one follow-up. For our first question, we go to Ollie Herrera, CKPG. Ollie, are you there?
Hello, sorry, I was on mute. Hi, Dr. Henry. My first question is, can the comment figure out which demographic is responsible for the rising cases in Northern?
Yeah, so it's not just one single demographic. We know there are very high rates of vaccination in older people. We are seeing some breakthrough in older people, particularly in long-term care homes. So we know that it's not enough for them to be protected with vaccination by themselves. And it's one of the reasons that we've started to give a booster dose to residents of long-term care. We know that the immunization rates are lowest in the 12 to 17-year age group, even though they have been eligible for some months now. And we are starting to see increasing movement in some communities in the 20s and 30-year-old age group and 40-year-old age group. But I will ask Minister Dix to address this, because I know you have the numbers off the top of your head for many of the communities in the north. I will say that what we are seeing now, though, it is unvaccinated younger people, people in their 30s, their 40s, their 50s, who are getting severely ill and sadly are dying, and they are unvaccinated people.
Please go ahead.
Thank you. And in terms of demographics, I think what you see across the province is that over 65 people have seen the highest risk of COVID-19 from the beginning, and have seen that especially in the first year of the pandemic, and then subsequent to that. We see relatively little differences between health authorities, such that over 65, it's about 93% of people in Vancouver Coastal Health, and 87 or so percent of people in Northern Health, which is a difference, but not a large difference. Where we see the largest difference is under 65 of adults, where the rate of vaccination overall across Northern Health is at about 79% today, first dose over 12, compared to, say, 89% or 90% in Fraser Health, and 92% in Vancouver Coastal Health, 90% on Vancouver Island, and the mid-80s in the Interior Health Authority. So that's across the board. Where we see the highest differential is certainly in those categories of, for example, youth 12 to 17, and people in their 30s, people in their 40s, where we see a significant difference between Vancouver Coastal Health and the North. So I would say we need adults working age under 65. Many people work over 65, but between up to the age of 65 to increase vaccination rates across demographics in the North. And obviously you see different communities as well with significantly different rates of vaccination. Kitimat, for example, is in the 90% plus range and has been for some time. Prince Rupert is in the mid-80s, but other communities are lower than that. And we're making significant efforts. No community has raised its vaccination rate more than Fort St. John, but we're still at 72, 73%. We need that to be higher. And so what we're saying to everybody in the North is there is a path here. This is the frustrating thing for healthcare professionals, is that many of the cases we see in critical care today in BC, in our hospitals, people struggling to breathe, are preventable by vaccination. It's available in all communities, and everybody needs to do it. That is the path that we need to follow. Yes, the measures are important over the next month, but we need to continue to raise those vaccination levels. And if we do that, we can significantly improve the situation. But we have to continue to do that, continue to work on that, and I expect that people will. And it's time to get vaccinated everywhere.
Ollie, do you have a follow-up?
Yes, my follow-up question regards military help. I know in Alberta they brought out the military to help out with the workload in hospitals. We have a local nurse here who told us there's about more than 400 open jobs. So does the province have any plans right now to potentially bring military help to these hospitals, especially here in the north?
And so, Minister, I'll ask you to address that one, I think.
I think the issue and what we're doing, and what we've been doing is very different than in Alberta, where we see dramatically higher hospitalizations in critical care, and we want them to succeed because when they succeed, we succeed, and we're very supportive of all the efforts made by health professionals in Alberta. Right now, if you look at critical care in our province, we are within our base bed capacity overall, but in the north, with 58 patients essentially in the south, you see how we've responded. And it's been a massive response to ensure that we have adequate resources. Yes, there are unfilled positions in the north. We're working hard, and we've put together announcements and programs to address that, and we're going to continue to do that. Right now, it's not the military we need. What we need is vaccination. What we need is a reduction in transmission, and that's what we're doing. So we are dealing with the situation. It's basically, if you look at BC as a whole, a very similar number of people in hospital now as were in hospital a month ago. But what has changed is that we've had to cancel some surgeries and other procedures and exercise management, meaning that some people who would be getting care sooner are getting it later because of the spread of COVID-19. So our teams everywhere and in every health authority are doing a great job. There's no easy answer. We've got to do it. We've got to continue to give all of the focus we can to hiring more people, especially in the north, and that's what we're doing. But right now, it's not an issue of bringing the military in, but it is an issue of increasing vaccination so we can reduce those rates. And in the meantime, everybody in healthcare in BC is doing everything they can to support the north.
For the next question, we go to Matt Preprost, Alaska Highway News.
Hello, good afternoon. Thank you, Dr. Henry and Minister Dix. Just to clarify the orders that were announced today, particularly for organized outdoor events, are you saying that people will need to be fully vaccinated to attend Remembrance Day services in northern BC?
Yeah, the short answer is no. What we're talking about is an organized party or a wedding or that type of event. Those types of important ceremonies are what we call, in our sort of technical language, flow-through events, where people are able to keep a distance from each other, where it's outside. Having said that, we encourage people to keep them small, and I know we've worked with the Legions across BC and the Yukon last year and again this year. Keep it small. Invite only immunized people to come and others to watch it on TV or in a small place by themselves. We know that the few veterans that are still with us from the Second World War, we know that people who want to come to Remembrance Day ceremonies are also people who are more likely to have severe illness or to be susceptible to COVID. So let's respect them, keep the events small, wear a mask, keep your distance from others, keep them outside, and have those measures in place to protect each other.
Matt, do you have a follow-up?
Thank you. Yes. In regards to the vaccination clinics, particularly here in Fort St. John, obviously the mass clinic that we had at the mall has closed, and the clinics have moved solely so far this month to the public health unit, which, if you crunch the numbers, has been keeping busy, doing well over 20 shots an hour. But accessibility, supply, availability continue to be a concern, whether that is not enough people to administer doses, people looking for, say, AstraZeneca over Moderna or Pfizer, or people not being able to get a shot through their local pharmacy. What's being done to address accessibility, supply, and availability concerns for people who want to get vaccinated here in our region? I don't think demand is that low. Actually, I think it's higher than the recent numbers actually suggest.
No, I absolutely agree with you. And we've been working with IMSS-BC and with the North to try and expand the opportunities for people to get immunized. I will say as well, Northern Health has a number of clinics with some of the large industrial camps and employers across the North, which have been stepping up and requiring immunization of workers. And I know there's plans to increase availability. I will just say one thing about, we do have supply issues in a resupply issues in a limited way, particularly in the North where we have many small communities. So at some clinics, one or the other vaccine may be the only one available, but we can make provisions for people to come back at a time when the other vaccine is available. I also continue to encourage people to take what is there on the day that you arrive. The Pfizer and Moderna vaccines are interchangeable. They are both very safe and effective, and we're learning more and more about how effective they are. And before people say it, I know there's been concerns about having a mixture of Pfizer and Moderna and travel, and that is being worked on, and I am confident that we'll have that sorted out in due time. But and we have been engaging with pharmacies in the North as well. And I don't know, Minister, if you want to add to that.
Yes.
Just to say that Fort St. John, as I mentioned in my earlier remarks, has seen the highest increase. It was from a lower base, obviously, than some other communities, but we've seen a significant uptake in vaccination. And I think, and I want to express my appreciation to Mayor Ackerman and her team for that work. A lot of major employers as well who have been advocates of vaccination in the region who are playing an important role. We talked today, obviously we briefed today Northern MLAs. It was one of the points that MLA Dan Davies made to Dr. Henry and to the health ministry team at that briefing was the need perhaps to extend into off-hours vaccinations as well to allow for people to get vaccinated. But we've given a lot of opportunity to get vaccinated. You can tell that by how well Fort St. John has done, and tell people that they can also drop in to our vaccine clinics as well. And I encourage everyone to register and get vaccinated as soon as possible. And we're going to look at if there's increase in demand, we're going to meet that demand in Fort St. John. And as we have in the Peace Country in both Dawson Creek and Fort St. John and Chetwynd and other places in the past, that has involved as well supplementing Northern Health staff in the past with other staff. And so we're going to look at all those options to make sure that everyone can get vaccinated. But I think the evidence is that we're doing well in Fort St. John, and that's because of the incredible healthcare workers and people in that community.
For the next question, we go to David Mulco, CTV.
Hi, Dr. Henry, Minister Dix. I wanted to ask, Dr. Henry, you mentioned briefly about breakthrough cases. I notice, if I'm looking at the numbers right, it looks like it's a higher proportion of fully vaccinated people who are now ending up in hospital. I wondered how that might impact your timing and thinking for more widespread boosters.
Yeah, so there's a couple of things around breakthrough cases that we are watching carefully. We know that as more people are immunized, the numbers of breakthrough cases and therefore the percent in a day will go up. But if we look at it in terms of rates, for fully vaccinated people, it's still 50 times lower risk of hospitalization and infection than people who are not yet vaccinated. So it's because it's such a smaller number of people who are not yet vaccinated. In terms of booster doses, we are looking at this, and we started with people who don't mount a strong immune response to their first series, so the first 2 doses, so people on cancer therapy, solid organ transplants, people on dialysis, and we have started that program to provide a 3rd dose to try and get them a boost at all of the primary series, and we started booster doses for our elders and seniors in long-term care. We are looking very actively at are there other groups where it is important at this point in time to receive a booster dose? And we'll have more to say on that in the coming days, because there is increasing data and evidence that we're reviewing around that. So that would be people, seniors and elders in the community, people who are immunized first, people who are immunized with a shorter interval than others, because we know that longer interval that we've been using has meant longer lasting protection. I will say that for most of us, young, healthy people, that we are still seeing very strong protection from the two-dose vaccine program that we have here in BC, and that vaccine effectiveness is lasting 6 months, 7 months, 8 months. So we'll have more to say about that soon, but that is one of the things that we're looking at in some detail.
Over to Minister Dix.
Percent of people have received their first dose immunization. 82.9% have been fully vaccinated in BC. That's the vast majority of people. So 82.9% fully vaccinated. An additional 6.1% have received their first dose partially vaccinated, many waiting for their second dose now. There's a delay, there's an interval between the doses. And so obviously that means that the vast majority of people are vaccinated in BC. If you look at the critical care numbers, yesterday there were 153 people in critical care, essentially, in that case, less than 10% of those. In a province where almost 90% of people are fully vaccinated, are represented by fully vaccinated people. So there's a tendency to look at the difference between 16 in one day and 13 in another day. If BC was made up solely of fully vaccinated people, we'd be in a completely different situation. This is a pandemic of the unvaccinated. I want to say to people that if up to now there's a sense that people have either not paid attention or stopped paying attention, COVID-19 is with us, particularly in the north, in a way, in a transmissibility that it hasn't been. And this is the time to get vaccinated. You need to take this seriously. You need to take it seriously for your own health. Someone passed away in their 20s in the north today, and you can imagine how their family is grieving. You need to take care of that for your loved ones, for people in your community, for people in the province. It is time to get vaccinated. There is going to be all kinds of details about the increases amongst those who are fully vaccinated, and there have been, so far, clinically vulnerable and people in long-term care, about 40,000 people who've got a third dose either to complete their course or to get boosted against COVID-19, all of them seriously clinically vulnerable. Those steps are going to be taken. But I would say to everybody, it is time to take this as seriously as you would, as if your health was at stake, because it is, because of the ones you love's health is at stake, because it is. And take the actions and the measures that have been put in place today, and the need to get vaccinated with all the seriousness that you would with anything else that threatened the ones you love.
David, do you have a follow-up?
I do. Dr. Henry, just on transmission, I wanted to follow up on the U.S. land border reopening to Canadian travelers, maybe more movement because of that. My question is, are we seeing travel, whether international or between provinces, significantly play a role in spreading the virus at all? And a second part of that, I know it's federal jurisdiction, but do you support continuing mandatory negative testing for those coming into Canada?
Yeah, so complex questions. We were actually on a call today with Transport Canada and CBSA about some of these issues. We have seen some introductions through travel, and it has varied as we've gone through this pandemic. The travel restrictions have been effective, and if we look at last year respiratory season, the international travel restrictions that were in place meant that things like influenza was almost non-existent, well, essentially non-existent here in BC anyway, last year. We are seeing other respiratory viruses start to increase in the community now. And part of that is because we're moving around more and we're getting together more. We're doing more things. And we can do that because of vaccination. We have a program at the borders now. And there's a risk assessment that's been done where pre-screening, so somebody having a negative test before arrival, is actually a very effective way of preventing somebody who has active COVID from traveling. So for international travel by air, I think that will still remain a part of it. It's less of an issue in the land border from the data that we've seen. So I know we're looking at whether it's still going to be required at land border crossings, particularly with the U.S., obviously, as we move into November, when that's going to happen. And I think the more important will be making sure that we have vaccination status and that people can prove they're protected through vaccination. So we have seen a decrease in the introduction of new strains through travel once immunization came into effect, and since the borders have reopened to international travel, the fact that we are requiring both the testing and the proof of vaccination has kept that at a low level.
For the next question, we go to Richard Zussman, Global News.
Minister Dix, I'm hoping to get an update from you in terms of the number of COVID cases linked to Willingdon Care Centre. How many of those are in the residents and how many in the staff? And for Dr. Henry, considering the rapid increase in cases we've seen at the care centre, does this show that we were a little bit too slow to put booster shots in place to protect the most vulnerable in long-term care and the other most vulnerable in our population?
Thanks, Richard. Maybe I'll take the first and then hand it over to you, Dr. Henry. There are 89 cases at the Willingdon Care Centre. The majority of those are amongst residents and obviously a significant number amongst staff. I think, I don't have them all memorized, Richard, but I think it's about 70-20, 70-17 or 65-22, but it's available of the number of people who are tested positive for COVID-19 is part of the report we did this morning. There have been a number of people who have passed away. As you know, we don't report that immediately. It takes some days sometimes to report it. I understand that there have been a significant number of people who passed away at the Willingdon Care Home who, when they passed away, were positive for COVID-19, which is obviously a huge consideration. So the steps we've had and continue to take in long-term care are significant, including third doses, including high-dose flu zone for everybody to protect against the flu. Obviously, the mandatory vaccination for staff, all of those are recent steps, and then all of the other steps from the single-site order to others that we're taking in long-term care. We've had a number of cases in the last period in long-term care, particularly in interior health, but Willingdon is currently, by a significant margin, our most significant outbreak, and so that's why we're taking the steps we are. But those are the case numbers, and I think you'll also see an increase in the number of people who passed away reported over the next number of periods related to the Willingdon Care Home. It was 3 in the report this morning, but I believe once we report over the next couple of days, we'll be up to 10.
And we'll come back to Dr. Henry here in Victoria. Minister Dix, there was a little bit of confusion off the top, so perhaps you'd like to speak after Dr. Henry for this question to reiterate your first few points that you made in that response. I'll now hand it over to Dr. Henry to answer her portion of the question.
Sorry, I jumped in with answering the second question first, which was around, the timing of booster doses. This is obviously something that we've been watching really carefully. We've been looking at the vaccine effectiveness. We've been looking at outbreaks. We've been looking at how we've been able to manage them and suppress them. And we have seen that when this virus, particularly the Delta strain that we're seeing, is introduced into those communal living settings with very vulnerable people, that it can spread very quickly, very rapidly. And we were looking at the data from around the world of when is the best timing. And the National Advisory Committee on Immunization, as you know, recommended 6 months between dose 2 and a booster dose. And that's what we have gone with here in BC. It is out there now. We are immunizing residents across the province and in many cases concurrently giving protection against influenza for the coming season. And we are looking at the very same data. We have good data that shows us that seniors and elders in our community are still well protected, but we know that other places around the world that does wane over time, at least from infection, although we seem to have good, strong protection against severe illness for some time. But it just reminds us that this virus is here. It's in our communities. It's spreading. We do the best that we can to protect ourselves by being vaccinated, but we can't let go of those other important things, particularly when we're in settings where this virus can spread really rapidly, which is indoor settings when we don't know who we're around, when the ventilation may not be great. That's where things like mask wearing, staying away from others if we're not feeling well ourselves, making sure that we're washing our hands. Those are the things that are also important for us to not forget right now.
And we'll send it back to Vancouver now. Minister Dix, if you'd like to reiterate the first few points of your response.
Sorry about that. From memory, I think it's 89 cases at the Willingdon Care Centre in total. I think in the range of the significant majority of those cases are residents. I think it's 65 to 70 in that range, 17 to maybe 25 are amongst staff, and that information is available on the report that was sent out this morning. As I noted in my first answer, Richard, I think on that report, 3 people have passed away, more people have passed away, and we'll be reporting those out in the coming days. I believe the number confirmed with COVID-19 as we report out those cases, whereas a number of days lag will be right now is 10, and that's a significant tragedy at the Willingdon Care Centre and for everyone involved there. And so what that tells us is all of the steps that Dr. Henry has described are needed to continue to protect long-term care. Willingdon is our most significant case. We saw some significant cases in August of care homes with very important outbreaks in the Interior Health Authority, and we have to continue to take steps to protect long-term care, and that's why the vaccine mandate came in effect on Tuesday. That's why we've got third doses. That's why other orders to protect long-term care settings are in place for all of those reasons, to ensure that because of the vulnerability of people there, to ensure that they're protected to the maximum possible degree, as well as being able to live as normal a life as possible as you can in those settings during a pandemic.
Okay, Richard, do you have a follow-up?
As we look at these boosters now for those in long-term care, but also extended to those who are clinically vulnerable, what factors being at play in terms of what vaccine people are receiving, Dr. Henry? You know, some of the guidance that's being given is that if you received Pfizer for your first 2, it may be better to get Moderna as a third. You know, what numbers are we looking at to indicate that? Are you worried about what that may mean for people in terms of mix and matching? And what is the advice for those who have received multiple doses of AstraZeneca, considering that is no longer available as a third dose?
Right. So a couple of things. Booster doses will be with the mRNA vaccines. Right now, they're an off-label use. They're not approved by Health Canada for use as a booster dose. However, we do use a number of things off-label, but the booster doses will be primarily with mRNA vaccines. So somebody who has had AstraZeneca, you can expect, if and when we need a booster dose, that it will be with an mRNA vaccine. And that is because of the studies that have been done showing their effectiveness as a booster dose. Whether you get Pfizer or Moderna, depending on what you've had before, or whether it makes a difference, that's something that is interesting, because we are increasingly getting more information about which one works as well or better than the other. And there is ongoing information, mostly based on what we call immunogenicity, so the antibody levels in our blood. And as I've said many times, we don't yet have an absolute correlate of protection, but that Moderna seems to give higher antibody levels that stay longer. So Moderna vaccine, it's not surprising if we think about it, it's got a higher amount of the antigen, the mRNA in it, compared to Pfizer, and it does give it seems to give a stronger response. For specific groups, though, Moderna is preferred, and that's for people who have solid organ transplants, some people who are severely immune compromised, and the studies that were done with a third dose using Moderna gave a higher proportion of people who developed a stronger immune response. So we have been preferentially saying that people should use Moderna if you're somebody who's had a solid organ transplant, or it gives the best possible chance of boosting that immune system and getting it up there. So a full dose of Moderna is something we're also recommending for long-term care, but it's not as clear for people in long-term care whether there's a significant difference between Pfizer and Moderna. So it's whatever's available. I will say we're not going to be changing our definition of what is fully vaccinated right now with booster doses. The vaccine card, for example, will be based on the 2 doses, or currently a single dose if you have J&J. But yeah, there's lots of more and more data that's coming available from around the world that is showing us that actually mixing and matching gives the body's immune system several different ways of responding, and it may actually give you stronger, longer-lasting response.
We have time for one more question, and we'll go to John Hernandez, CBC.
Hello there, and I'll just ask for answers in both English and French. Just going back to the border, the U.S. hasn't indicated if it will accept travelers with mixed doses. Will you commit to offering a third dose by the time the border reopens to people who have had mixed doses if the U.S. doesn't accept them? And if not, why not? And you mentioned the rules might change in due time, but how long do you think that might take?
Yeah, well, if you've been watching, it's been changing. Sometimes one thinks daily, but certainly weekly around the world. This is an active area of discussion, debate, review, and the advisory committee in the U.S. is looking at these issues right now. So is SAGE, the advisory committee for the WHO. These are important questions, not just because we've used them here and we've shown how effective they are, but these data need to be shared. It's important for us globally to be able to mix and match vaccines and know that they work because of the way the vaccine supply has been sometimes interrupted, challenges in dates and expiry and getting vaccine to different countries. So this is an important global question to make sure that we can increase protection for people around the world. So that's why I'm confident, because Canada's been leading on some of this data, so is the UK. There's 19 European countries that also use mix and match schedules. So these are things that are going to be accepted as this data becomes available, and it shows how well it works.
And now we'll go over to Minister Dix for French.
Notre priorité, c'est toujours la santé des gens. Et donc, c'est notre priorité. En ce qui concerne une troisième dose d'un vaccin de COVID-19. Maintenant, on a, je pense, vacciné 40 000 personnes dans les centres de soins au long terme, bien sûr. Et deuxièmement, ceux qui sont vulnérables cliniquement, extrêmement vulnérables d'une manière clinique. Dans la province. Donc ça, c'est notre priorité pour les troisièmes doses, et ça va continuer à être notre priorité d'ici à l'avenir. La question de l'acceptance des autres pays dans le monde de ce qui se passe et ce qui est évidemment réussi, c'est-à-dire la décision de donner des doses aussitôt que possible aux gens, malgré le type. Ça, c'est une politique réussie en termes de santé. C'est une question politique pour d'autres pays, et on travaille fort pour assurer que tout le monde est en mesure de voyager. Mais notre priorité pour les troisièmes doses, c'est ceux qui sont vulnérables, premièrement, ceux qui vivent dans nos centres de soins au long terme, et ça va continuer à l'être.
John, do you have a follow-up?
Yes, I do. This one for Minister Dix, and again, I'll ask for both English and French. On Tuesday, you indicated that about 1,900 long-term care and assisted living staff are not vaccinated. Can you update us on how many of those staff members have now been placed on unpaid leave, and what's the percentage of unvaccinated healthcare staff in hospitals and clinics around the province?
On a donné des renseignements sur cette question mardi. C'est-à-dire que 96% des gens qui travaillent dans les centres de soins au long terme et 97% des gens qui travaillent au assisted living dans notre province ont été vaccinés, ce qui est quand même une réponse impressionnante un peu partout dans la province. Il y a un tas de centres, un tas de maisons dans la province où la totalité des gens ont été vaccinés. On a, comme je viens de dire, 1900 personnes qui n'étaient pas encore vaccinées et ce qui est clair, cela suit de notre décision d'il y a plus d'un mois maintenant qu'ils ne travaillent pas actuellement et ils sont au congé sans être payés actuellement. Donc, c'est tout le monde dans ces catégories. Il faut dire que des gens souvent travaillent dans le secteur au temps partiel ou provisoire. Et donc, bien sûr, il y a un nombre signifiant des gens qui sont dans ces catégories. On travaille fort partout dans la province pour répondre à cela. Et on voit cela dans tous nos centres. Notre but, évidemment, c'est d'assurer la santé des gens qui habitent nos centres et qui travaillent dans nos centres avec cette mesure. Et on est confiant d'être en mesure de le faire, mais c'est pas facile. What I said in French was it's not easy, obviously. The vast majority of people in long-term care, 96%. The vast majority of people working in assisted living, 97%, have received at least a first dose vaccination from COVID-19. And the rule is very straightforward. It's a provincial health order. It applies to everybody. So that means if you're not vaccinated, you're not working right now in long-term care and assisted living. Dr. Henry has talked about the order for acute care that was and the order for acute care in other parts of the healthcare system that will be coming in force October 26th, and that has been posted now. But in long-term care, the situation is you have to be vaccinated. And the reasons for that, I think, are obvious for everyone. It's the protection of those working in the sector, the protection of those living in long-term care and assisted living in our province. And you don't have to, to have seen the significant impact on that on people's lives over the course of the pandemic is, I think, obvious why that's important. It's also important because we don't just want, this is where people live, these are their homes, and we're often in long-term care, people are, because they're, in some fashion, their bodies have failed them, but we need people to be able to continue to see the ones they love, and that means ensuring that everyone's vaccinated so that we can have more normal life and normal activity. People paid an extraordinary price in long-term care, and these actions, the vaccine mandate, is a requirement for us to continue to ensure people are protected, and we intend to see it implemented. It has been implemented, and I want to thank all the people working in long-term care and who've worked very hard on this. And it's my hope that even more people, amongst the small percentage of people who are not vaccinated at the moment, will get vaccinated and continue to do that important work, because our long-term care workers have been, I think, a source of inspiration and courage in this pandemic, and we want to continue to work together, all of us, as part of a team.
Thank you, everyone, for participating. That concludes today's event.